Hi there, I'm Dr. Corey Howard, and I am a board certified internist specialist in anti aging, functional, and regenerative medicine, and specifically hormone therapy. And this is a topic that is extremely important because so many people have issues. Now, this is not for the people that are in your 20s and 30s. This isn't just a male testosterone talk. This is really looking at just the general ideas that you need to know about hormone and hormone regulation. And so I'm Corey Howard. I have extensive experience, 27 years in private practice, multiple board certifications, and really here to hopefully give you some good information. Now, what we're talking about just health in general, and health in general it really has to do with your diet or nutrition, fitness, physical activity, how your body responds to stress, sleep management, environmental factors, and love and connection or relationships. And that's kind of like the big picture. Now, we're just going to dive into steroids. And what you're looking at here is a fairly complex picture of how hormones are made. Now, there will be no quiz after we're done today, so don't worry about that. But, we basically start hormones with cholesterol. And so cholesterol is kind of like the big thing. It's in everything. It's in every cell. It's made up from every hormone. And cholesterol forms into something called pregnenolone, which forms into progesterone, which is a hormone that is found primarily in women, very small amounts in men. And then ultimately makes two other substances. And then you'll see them. They're kind of in yellow. One is DHEA and one is cortisol. And those are made in your adrenal glands. And they're made in the adrenal glands as a response so that when people are overworked, overtired, those are two hormones that tend to drop, and you can check those pretty easily. Essentially, we then get through another precursor, which is called androstenedione, which eventually forms into testosterone. Testosterone then turns into estradiol. Estradiol is the main hormone found in women and before you have menopause. And then when you reach menopause, I'll show you in a second that those hormones decline. There are two other estrogens that are also very important. One is called estriol and one is called estrone. And again, we won't be quizzing you on any of those, but here's conceptually what you've got to think of when you're thinking of hormone therapy. You're thinking of a symphony. That means you have all of the different instruments playing, all of them are in tune, and it sounds great. But what happens if one of them is just a little bit out of tune? Well, you can still play, not a problem. It just doesn't quite sound as good. What happens if you're missing an entire section, say the flutes, just don't have them in there? Well, again, you can play, but it doesn't sound good really at all because you already know that something's missing. So your hormones are literally a symphony. How the thyroid interacts with the adrenal glands, and the adrenal glands work with the pituitary gland. The pituitary gland works with the other glands and turns them on and off, and they all interrelate to one another. And so you have to have them all to really function at your optimal self. Just saying. Now, what are the major hormones? The major hormones are right here. Estrogen, progesterone, testosterone, adrenal hormones, and thyroid hormones. I'm going to focus on each one a little bit, not giving you too much incredible detail. But once you know a little bit, you can then go ahead and say, well, is this something for me? Do I need to look into this further? Should I see my doctor? Should I get a consultation? Should I call Dr. Howard? But, at the end of the day, the reality is I just want you to make sure you understand it. And so what are the effects of estrogen? That's a big question. Like, what does estrogen do? Well, think of the heart, the liver, the brain, the bones, the skin, the uterus, the ovary, the breast, the brain, everything. It literally does everything. It works on each one of those areas in your life. And so, for example, in the brain, it regulates temperature. So what happens is postmenopausal women, they have hot flashes. In your ovaries, it helps really make sure that the ovaries are able to release mature eggs. The uterus, we're going to talk a little bit more about how progesterone affects there. The skin has anti-aging effects. The liver has cholesterol production, meaning that, yes, when your hormones are off, your cholesterol could be off too. It might not just be because you've got cholesterol issues. And then, of course, your bones. You've heard of thinning of your bones with aging, called osteopenia or osteoporosis. And those are very serious issues that are also related to your estrogen. Now, this is interesting. So the top of this is going to be what happens in a normal young woman when they're having their menstrual cycle. And maybe people want to listen to this or not, but this is very interesting because what happens is that early on, estrogen peaks. And then what happens is you get something called luteinizing hormone, which tells the body, hey, you know what? You might get pregnant, so we've got to get the uterus ready for implantation. And so estrogen levels drop a little bit and causes progesterone levels to rise. And as they begin to rise, that causes a thickening of the uterus, the endometrium, which eventually, if you do not have implantation or pregnancy, you wind up having a period. And it's pretty much just like that with plenty of variations. Now, I'm going to flip down to the bottom of this, and hopefully you can see this as well, because in menopause, you don't have any of them. There is no estrogen being produced. There is no testosterone being produced, very, very little. And there is no progesterone being produced. And so a lot of problems occur from that. And so we actually have many symptoms of menopause. This is just a list of 34 different symptoms. Most commonly, people think of hot flashes or a decrease in libido, night sweats. Believe it or not, vaginal dryness is a very strong symptom, leads to something called dyspareunia, which is painful intercourse. But it can also lead to mood swings and breast pain and headaches and GI disturbances, hair loss, fatigue, changing your hair, changing your nails, could lead to anxiety. You can just see that menopause winds up having so many different symptoms that some of them are pretty obvious and some of them are not so obvious. And guess what? You don't have to suffer. And so these symptoms of low estrogen during menopause, you can see, are broken down into physical and psychological symptoms. And so if you have any of these things like mood swings and irritability, depression, panic attacks, fatigue, hot flashes, night sweats, irregularity of your periods, so this could be in a perimenopausal woman as well, meaning that they're not quite finished, so their body is like trying to squeeze out the last little bit of hormone, and then loss of libido or sex drive, very important. Now, functions of testosterone are pretty much the same in men and women. I mean, it's involved with your heart health. It's involved with circulation, the brain. A lot of brain fog occurs. So, you may be thinking like, I'm not quite as sharp as I was. I'm only 45 or 50 years old. And so what is going on? Believe it or not, that very well could be testosterone. We talked a little bit about that in relationship to sex drive, but also can affect your metabolism. So specifically in men, when you start to have a drop in your testosterone, you start to get a little bit more belly fat. So if you look around, you see quite a few men as they get older, they just got a little bit of a belly. Now, that's not because they're just not exercising. It's actually from a significant drop in functional testosterone, meaning that they may have some testosterone floating around, but it may not be enough. And it works the same way in women as well. Now, here in men, testosterone begins to drop somewhere in the age 30 to 35. And it continues to drop throughout your lifetime. So it's a good idea when you are young to get a level done pretty early just to kind of see where you're at. But it can go up and down. We're not too hot to jump on doing testosterone therapy in young men for reasons that it can cause some potential problems, but it's all part of the doctor-patient relationship when you're talking about it to make sure you understand both risks and benefits of everything and anything that you ever do that is prescribed by a physician. But in men, instead of menopause, it's called andropause. And andropause has, believe it or not, the same kind of symptoms. Has mood swings, depression, a decrease in motivation, lack of focus, lack of energy, muscle loss, which is really important, especially as you get older. Erectile dysfunction could also be, although I will say number one thing for erectile dysfunction or inability to maintain an erection is that make sure you've looked at the heart, especially as you get older. That's very, very important. And weight gain and bone loss can also occur in andropause. Now, when you're looking at the comparison between andropause and menopause, you're like, they look kind of similar. And that's because they do. And the reason they do is because your body needs all of these hormones to function properly. And when that's not happening, you start to say, well, maybe it's just me. Maybe I need to go to the gym more. Maybe I just need to change my diet, or maybe I need to talk to a therapist or something like that, or I'm having trouble in my relationships and it's got to be me. But at the end of the day, it's probably not you. It's probably your hormones as a big part of it. There's obviously it's multifactorial, meaning that lots of different causes are potential. Testosterone functions, you can see here in women, again, the same. Libido improves the brain, especially spatial memory, very important. Muscle mass in the breast, it prevents estrogen proliferation, which can change the breast tissue. Bone growth, reproductive health early on. Later on, of course, we discussed that. So you can see the importance of a lot of these hormones. Now, what happens when you have low hormones? Well, testosterone specifically affects the adrenal gland and the adrenal gland function, which has to do with metabolism. So that's where that part of fatigue comes in. So it's not just giving you testosterone like, dun, 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 I'm testosteroned up. No, it's actually the testosterone is interacting in the symphony with these other hormone areas, and in this case, the adrenal glands, memory loss, depression, as well as blood count changes, skin changes. So you really want to begin to see that. Progesterone, a little bit different here. We can start to have functional problems with your liver, thyroid. Remember, again, I'm talking about how they interact. The progesterone directly interacts with the thyroid gland and the production of other issues. If you have thyroid problems, progesterone is going to be a problem because they all interact. High cholesterol, migraine headaches sometimes, sleep problems, very common in a menopausal woman. Interesting thing is that progesterone, when it's taken orally, actually goes ahead and crosses the blood-brain barrier and binds to a receptor in the brain called the GABA receptor, which actually helps you with sleep. Now, adrenal glands, there are multiple adrenal gland hormones. So it's not just cortisol. It's catecholamines, it's different kinds of peptides, androgens, like we talked about, including estrogen and testosterone, glucocorticoids and mineralocorticoids, which have different functions. The glucocorticoid group is the cortisol part. The other one has to do with blood pressure and regulation of blood volume and things like that. And you can see that the organ itself is not just one simple thing, but a complex organ. Thyroid hormone is a little bit different in that the pituitary gland basically sends a message to the thyroid to say, give me some thyroid hormone. And that's called thyroid stimulating hormone. Then the thyroid gland makes thyroid hormone, which is called T4. That's also a medication that we give called levothyroxine. And that T4 is basically 4 molecules of iodine. And then what happens, it feeds back to the pituitary and says, hey, you know what? I got enough. Or sometimes, hey, I need more. So it can stimulate it or up or down regulate it, so to speak. The T4 breaks down in the presence of selenium to release a molecule of iodine to form T3. And that's actually the active form of thyroid hormones. So you need to be checking T3 levels when you check thyroid hormones. A lot of times doctors aren't doing that these days because it's a little bit more expensive. Now, here's an interesting part. If you heard what I said, I talked about iodine. Iodine is very important. These days, everybody's on a low iodine diet, a low salt diet, or just fancy schmancy salt diet, and you're not getting iodine, which leads to thyroid problems. So it's not actually a thyroid disease. It's a nutritional problem called subclinical hypothyroidism, and we can look at that. And so that is another thing that's really important here is when you are having a diet that's low in sodium and you eliminating that and you're eliminating iodine, you can run into some problems. Now, this is one of my favorite things because we have talked a little bit about the mitochondria before, but the mitochondria is where the organelle it's like the nuclear power plant of your cells. And so that's where protein, fats, and carbohydrates enter, go through the cycle using 21 different nutrients and makes energy. So that's where energy production is. And all of this interplays. Now, in this particular case, the mitochondria is not as affected by the hormones. What's affected is that as you decrease the testosterone, you decrease the muscle mass, which decreases the nucleated cells, which then decreases the number of mitochondria. So now you've got another reason why you could potentially be fatigued, because it's the only place you can make energy in the body. And we can talk more about that at another time. So what about your diet? Well, I look at the diet. Whenever you look at things, you can see in this the different compounds are in different foods, whether it's lycopenes or sulforaphane or vitamin A or vitamin C and copper and zeaxanthin and ligands. And, these are potentially anti-cancer substances. So you want to have a diet that supports the nutrition, especially as you're getting older, which can then help your organs produce the hormones that they need to produce. Now, I'm just going to briefly talk about hormone replacement therapy. If you want to know more about hormone replacement therapy, go to my website at www.howardhealthandwellness.com. That's www.howardhealthandwellness.com. At the end of this video, there will be a link for you to check. And then you can just go ahead and read up a little bit more in detail the information that I have. And if you happen to have some questions, feel free to shoot me a couple of questions, and you can do that through the website as well. Different types of hormone therapy are different in men and women, but you've got basically topical creams or gels, injection therapy, and then something called pellet therapy. Now, in women, you can also use intravaginal therapy, which is in the form of tablets or suppositories or creams as well. And everybody's different on who does what. I use pellet therapy a lot. Usually not as the first thing I do, because I want to see how they're going to respond. Pellet therapy is basically a very small piece of material that goes underneath the skin. It is dissolvable, usually lasts between 3 months and 4 months, and gives you a nice, even level of hormones over time. Again, more information can be found on my website regarding this. But I want to show you something here that is pretty interesting about them. You can see at the bottom when you're taking either things orally or in creams, there's a lot of variation on what happens. Same thing with patches, although it's a little bit better. So a patch might be an estradiol patch. So over time, it dissolves. Usually it takes only a few days in that case. Injections are a little bit better, but pellet therapy gives you a longer optimal level. And so you don't have these ups and downs. And that's why pellet therapy probably is best overall. So in summary, just so you know, your hormones will decline as you age. They affect all of your organs, whether it be your heart, your brain, your bone, your skin, metabolism, and mood. And so what you really need is to have a proper evaluation and management of your hormones. And so I am Dr. Corey Howard. I'm a board-certified internist and specialist in hormone regulation. Check me out online. Have a good day.